It just feels sometimes like you're screaming into this void of saying this is unfair and the system's not working.
I have a permanent shoulder injury, and with the slip disc, it's in the lower back, so that affects my right leg.
I've had a cyst that burst on my uterus, on my ovaries, I have endometriosis. I also have tight ligaments in my uterus, and I have something that we're trying to work out at the moment.
I've been a registered nurse for 40 odd years. I worked in general nursing in medical surgical areas.
Well, I fell down 20 stairs. I put my heel on the top step and put my foot on what I thought was the rest of that step and proceeded to fall just like as if, just like what you see in the movies. I hit my shoulder 3 times on the last 3 steps, ended up upside down on my head like this.
One day, woke up, went to uni, went to hop on my bike, and passed out when I tried to hop on my bike from this really kind of sharp, severe pain. And by the time I got to emergency, I was in a much worse state. Ended up doing some tests and them essentially sending me home, and things just got worse and worse.
There was one occasion, probably about 15 years ago, where I constantly tried to say I don't have asthma, when I would be put on asthma medication.
I said I had a sore knee and a sore hip. All that they looked at was my shoulder. After explaining, finally, after 12 months, I got a doctor to say, oh, okay, well, let's go do a scan.
I knew my family history, I knew that my symptoms, and it ended up that I had pneumonia, so I kept getting the wrong treatment, and then I kept on having to push forward and ask, and then went to a specialist, and finally I got put onto the right road.
They did a scan, and it had turned out that during that week the cyst had ruptured at some point, so that was why I was in so much pain and why I felt so just so sick. It turned out that when the cyst had burst, essentially it had infected my pelvis.
And that's when they found there was a bulging disc in my lower back.
It seems like this blur of when did I go into doctors, when did I go to hospital. So it's just this constant week or 2 weeks. It was just go and it'll get better. There's no talking about what if it doesn't get better, which it did quite a few times not get better, yeah.
I went back to visit my doctor when the results were in, and he goes, oh, well, I've looked at them and there's nothing wrong with you. And I said, well, no, I don't believe that's true. Are you sure? Because I spoke to the doctor there and he told me that there was a problem with my AC joint and that there was something that can be done. And he said, no, there's nothing there. All the scans are clear. There's nothing wrong with you. It's just all in your head. He started to get really angry then, because it was very much like, how dare I question him? And he stood up and he was just like, no, that's it. Are you questioning me? He really got very, very angry.
I don't know, I think it's hard. It makes me reluctant to go back to doctors in some ways. It makes me go I don't want to go back to hospital because that experience was so bad.
And then here's my doctor, who I trusted for years, telling me to get out of his office because I dared to question him. I just wanted help. I just wanted some relief. I just wanted someone to believe me and to just help with the constant pain.
Just the way that the system expects you to come in, have all your medical history, having understood when doctors the previous time didn't explain things to you, and it's kind of this pressure on you when you're sickest and in your worst place to be able to advocate for yourself.
If a patient says they're in pain, don't tell them they're not.
I find the biggest issue with a lot of the doctors that I dealt with is that no one wanted to hear what you had to say. No one wanted to listen.
I think the system's definitely biased against women. I think you know, I think as a society we're often like biased against women. So I think, you know, that system's so layered. I think just the way we consider women's health is really, broken and biased.
I think that could be multifactorial. I think I'm not a man, so I can't speak for the average male's experience as a patient.
Unless something shows up definitively on a scan, then it must be in your head. But also I think there's a little bit of ego. I guess from the experience of my doctor, he was a male doctor, it was just that thing of, how dare you question me?
I feel that, there's a generational component to it, that sometimes certain male doctors can get into a bit of a boys' club. I think attitude comes into it, burnout, all of those factors interact. I think it's a power control dynamic when that happens.
Going and seeing doctors and advocating for yourself, I think is a huge thing that I definitely give advice to women about. I think like one of the things that's really like I do before my appointments now is I like write down all my symptoms. I also write down all my questions because I think it's really easy to get into especially specialist appointments and feel like you are answering their questions rather than, you know, it kind of being both of you bringing the information you have to the table and working it out.
Be persistent as much as you possibly can. You have to keep asking. You have to keep pushing forward. Ask for copies of all your results.
Listen and believe and trust in your own body. I also think become more politically and socially conscious and learn how to speak out and find your voice.